My name is Angela Acker, and I am with the University of Wisconsin Population Health Institute. Also presenting today will be Katie Weir with Robert Wood Johnson Foundation, Carrie Carroll and Aaron Schulten with University of Wisconsin Population Health Institute. Also, we have Olivia Little with University of Wisconsin Population Health Institute, who will monitor the Q&A box. Before we get started, we wanted to acknowledge the many challenges that we are all facing this year. The coronavirus pandemic, ongoing injustices, and inequities across the nation underscore the importance of community conditions and collective efforts for all residents to have a fair and just opportunity for health. It is critical, now more than ever, to uplift stories and communities building a culture of health. So thank you. Thank you for taking time out today to participate in this webinar as you consider applying for the prize. The RWJF Culture of Health Prize is a collaboration between Robert Wood Johnson Foundation and the University of Wisconsin Population Health Institute. Many of you know UW Population Health Institute from our work in leadership of the county health rankings and roadmaps for more than a decade. We are partnering together with others to help build a culture of health across the country. So let's get started. Here's an overview of what we plan to cover today. These areas encompass some of the most frequently asked questions about the prize, such as eligibility and how to apply. We also are sharing links to two essential documents, the 2021 call for applications and the frequently asked questions document, which is extremely helpful for applicants as it answers questions we have received from communities. We hope from this presentation, you will get all the information you need to decide whether your community is ready and a good fit to apply and how to navigate the application process. Now, I'll turn it over to Katie to tell us more about the purpose of the prize, starting with the Robert Wood Johnson Foundation's vision for building a culture of health.
Thank you, Angela. It's a delight to be with you all today. Our vision here at the Robert Wood Johnson Foundation is one where we as a nation all strive together to build a culture of health, a culture that enables all in our diverse society to lead healthier lives now and for generations to come. What do we mean exactly by building a culture of health? For us, a culture of health recognizes that where we live, such as our access to affordable homes, quality schools, good jobs, and reliable transportation, affects how long and how well you live. And you can see this on the next slide. For us, we've recognized that communities across the country are working together in new ways so that everyone can live their healthiest life possible, regardless of who they are or how much money they make. And a culture of health is happening in diverse places, in cities, counties, tribes, regions, and rural towns, with a variety of economic, social, and environmental strengths, as well as challenges. And as you will see in the pictures of prize-winning communities throughout this presentation, each place's journey looks different, but they all show us what a culture of health can look like. The RWJF Culture of Health Prize elevates the compelling stories of communities where members are working together to transform neighborhoods, schools, businesses, and so much more, so the opportunity for better health flourishes for all. As we thought about what the purpose of the prize was, and you'll see this on the next slide, we recognize that there are communities already doing this, and that's why the RWJF Culture of Health Prize was created. The purpose of the prize is to honor and elevate U.S. communities that demonstrate outstanding examples of the Foundation's Culture of Health vision in action, communities that are working at the forefront of advancing health, opportunity, and equity for all. By seeking out these strong examples of communities that are creating a culture of health, we can celebrate and uplift their successes to affirm their direction and provide ideas about what's possible that inspire other local communities. It also enables us to showcase the many unique ways that communities are working to ensure that all their residents have the opportunity to be healthier. As you can see on this next slide, there are 44 communities that have now been designated as RWJF Culture of Health Prize winners. The map here shows all the winners from 2013 to 2019, and the 2020 and 2021 prize-winning communities will be announced in fall of 2021. The winning communities span 26 states, including 5 federally recognized tribes. You can see that the prize recognizes all types of places: cities, counties, tribes, small rural towns, and interconnected regions, representing a wide range of physical, economic, and demographic characteristics. These places and their community improvement efforts are each unique, but they all show us what a culture of health can look like. So as you can see on this next slide, in addition to the purpose of the prize, you may be wondering what prize winners receive. It is very important to emphasize that the prize is not a grant. It is an award to recognize communities for what they have already accomplished on their journey to build a culture of health. Prize winners can receive a $25,000 prize, which the community can choose to use in any way it likes. There are not budget reports that are required from RWJF. The value of the prize goes far beyond the dollar amount, however. It is a national recognition that honors and elevates the work being accomplished in communities across the nation. Communities receive customized communications materials, as well as funds to support their communications activities that will be an opportunity for them to determine what communication tools will best support their work. Communities will receive communication support to aid in the national and local promotion of their stories, and winners will have the opportunity to connect with other national and local leaders working to build a culture of health, such as past prize-winning communities. Next, I'll highlight additional benefits from applying for the prize. Excuse me. I just highlighted those additional benefits, and so now let me turn to Angela to talk through things more. Thanks, Angela.
Thank you, Katie. I'm sure this has whet your appetite to learn more. So let's provide you an overview of the 3 phases of the prize application process. Phase 1 is the phase we are in right now. The Phase 1 application is open to all U.S. communities. We will describe this application process in detail today. Often people want to know how many applications are received for Phase 1. In recent years, we have received around 200 submissions per year. We'll then invite in a select number of communities to proceed to Phase 2. These applicants will have the opportunity to further expand on their community's work across all 6 prize criteria. Then up to 12 Phase 2 applicants will be publicly recognized as prize finalists and invited to host a site visit. Following the site visits, a set of finalist communities will be selected to win the RWJF Culture of Health Prize in 2021. Up to 10 winners can be selected. In past years, it has varied between 4 and 8. Please know that more detailed instruction will be provided to communities that move forward in each phase of the selection process. But we wanted to let you know what you can look forward to if your community advances. Here is an overview of the timeline, which is also detailed in the call for applications. We know you already have the Thursday, October 15th deadline marked on your calendar. Please also note the time of the deadline, 3 p.m. Eastern Time. This is an absolute deadline with no exceptions made, including none for internet connectivity issues or confusion about time zones. Then, Phase 1 applicants will hear from the prize team by the end of the day on November 13th as to whether they are invited to submit the Phase 2 application. Phase 2 applications will then be due December 21st. Then, applicants will be notified on February 16th as to whether or not they will be moving on to a site visit. Now, one of the biggest questions we are asked is, what types of communities are eligible to apply for the prize? This prize is based on geographic jurisdiction that reflects the work across the whole geography of your place. To be eligible to apply for the prize, you must present an application that reflects the work of a county, parish, borough, city, town, village, or other municipality with a publicly elected governing body, a federally recognized tribe or a state-designated Indian reservation, a Native Hawaiian organization serving and representing the interests of Native Hawaiians in Hawaii, and that is a customized definition for Hawaii only, or a region which is defined as geographically contiguous municipalities, counties, and/or reservations. Communities within U.S. territories can apply. For places where there may be unique municipal governance structures, we strongly encourage you to contact the prize team well in advance of the deadline to discuss any eligibility questions. For the purposes of the prize, individual neighborhoods, and those also include wards, as well as full states, are not eligible to apply. It is perfectly acceptable within the context of a city or county-wide application to feature the good work of a neighborhood, but please do so in the context of the broader efforts that are taking place within that town or that city or county. An organization or coalition can certainly lead in preparing the application. We know there is someone who has to be the author or leader or convener, but please remember that the prize honors the work of whole U.S. communities. To be competitive, it is imperative that applicants keep the community-wide focus throughout the application process. If the application focuses on the work of a single organization or program, it will not move forward. We also wanted to take a moment to address some of the questions we receive about eligibility. One question is, can communities located in the same state as previous prize winners still apply? That answer is yes. Each applicant will be reviewed individually, not in relation to other applicants or winners located in similar geographic areas. The map of the 44 past prize winners reflects this well. Another is whether past applicants can apply again. If you're a past applicant and you feel you have made significant progress in your community improvement work, then we welcome your application. Past applicants are reviewed individually each year and not in relation to what they have previously submitted. Exceptions to this are past prize-winning communities. If your community is already a culture of health winner, you cannot apply for the prize again. And communities that were designated as finalists in the 2020 cycle are not eligible to apply this year. The list for 2020 finalist communities can be found in our prize FAQs document. The past prize winners are listed in the call for applications. Now, I'll turn it over to Carrie to cover the prize criteria.
Thank you, Angela. Hello, everyone. Perhaps the question we get asked most often is, how do we decide which communities win the prize? There are 6 equally weighted criteria that underpin the selection process. In the first phase, we are most interested in how your application demonstrates the first 3 criteria: defining health in the broadest possible terms, committing to sustainable systems changes and policy-oriented long-term solutions, and creating conditions that give everyone a fair and just opportunity to reach their best possible health. The principles in these criteria are considered foundational to building a culture of health. So Katie and I wanted to take a few minutes today to walk through the details of each criterion. So starting off with the first, defining health in the broadest possible terms. Building a culture of health means using diverse and comprehensive strategies to address the many things that contribute to health, opportunity, and equity in our communities. One way of thinking about the many things that affect health is by looking at the factors in the County Health Rankings model on the next slide. When we talk about health, we're thinking about a wide range of factors, such as, but not limited to, those you see in the blue boxes on the right of this model. For example, where you see education, employment, income, including these boxes and those above and below them. These are areas we can all work on today to influence how long and how well people live, or the health outcomes, the boxes in green at the top of the model. So in your phase 1 application, we'll ask you to describe how your community is taking action across several areas that impact health, and in ways that respond to key challenges and that build on the strengths that are unique to your community. Now we know the strong connections between social conditions, economic opportunities, and our health. And so reviewers of applications will really want to understand how your community is addressing things like affordable housing, building high-performing schools, ensuring the community is safe for everyone. So I'll turn it back to Katie now to walk us through the second criterion. Katie?
Thanks, Carrie. Our second criterion is committing to sustainable systems changes and policy-oriented long-term solutions. For us, this means thoughtful, data-informed decisions that include a strategic mix of policy, programmatic, and systems changes designed to last. You'll see on this next slide, as part of this criterion, reviewers will be interested in how your community is making strategic decisions that are informed by data, evidence, and/or innovation, and that demonstrate how community leaders, organizations across sectors, and especially residents who are most impacted by the changes are all involved in collectively identifying priorities and taking coordinated action. This image on this next slide shows this in a little bit more depth. In your application, reviewers will be looking for examples of how your community is pulling together strategies that go beyond improving programs and services to thinking about making lasting, equitable changes to policies, systems, and environments. Sometimes this may be at the level of government through laws and ordinances, but also could be at the organizational level. For example, changing systems and practices within businesses, workplaces, and schools. And when programs are featured, it is helpful for reviewers to understand how they are part of a larger strategy and how the work is being sustained beyond any one grant period or funding cycle. We have been asked for examples of policy, systems, and environmental changes that communities have undertaken. There are many, but a few examples include investing in community development, job policies that promote economic security, trauma-informed care systems in schools or law enforcement, smoke-free or healthy food policies, and physical environment improvements, such as transportation plans that link to housing, jobs, and healthcare. Carrie, on to you for criterion number 3.
All right, thanks, Katie. The third criterion, creating conditions that give everyone a fair and just opportunity to reach their best possible health. So here we're talking about how communities work with intention to identify, reduce, and ultimately eliminate barriers that limit opportunity, and in doing so by partnering with those residents most directly impacted by local challenges. This criterion centers on ways that communities value diverse perspectives and foster a sense of security, belonging, and trust. Specifically, reviewers will be interested in examples of actions your community has taken to remove obstacles to better health. For example, how do you work to increase the ability of residents, those who have most historically been excluded from opportunities, how do they fully participate in problem solving? And how do you share power and leadership with residents who have been traditionally absent from decision-making processes? On the next slide, we can say this in a few different words, but we're really wanting to hear about how you're partnering to address disparities and inequities, really going beyond targeting programs and services to residents. So what I'm trying to stress is going beyond targeting programs and services to residents experiencing negative health outcomes. So you'll see in prize stories, stories from past prize-winning communities, some terrific examples of places acknowledging complicated histories, drawing on strengths from their diverse cultures, places mobilizing residents and young people to improve their communities. Katie, please tell us about criterion number 4.
Thanks, Carrie. As we've mentioned, the first 3 criteria that we just stressed are the main focus of the Phase 1 application. However, we are also looking for standout work in the next 3 criteria, and more information will be shared about these criteria for applicants that move to Phase 2 of the selection process. Criterion 4 is maximizing the collective power of leaders, partners, and community members. And it's about how individuals and organizations across sectors and disciplines are all working together to provide everyone in the community with the opportunity for better health. As you can see on this next slide, we are encouraging communities to demonstrate how they have built diverse and robust partnerships across business, government, residents, nonprofit organizations, faith-based institutions, and more, including those with the quote-unquote non-traditional health partners, such as community developers or educators or law enforcement. How are you creating the structures and capacity for shared buy-in, decision-making, and coordinated action and accountability across partners? Another key element of this criterion is how your community is fostering inclusive civic engagement and leadership capacity among all community members and inspiring people to take action to support change for better health. Carrie, to you for number 5.
All right, the 5th criterion is securing and making the most of available resources. This means adopting an enterprising spirit toward your community improvement efforts. We'll see more about what we mean by this. We're eager to hear how your community looks at and examines potential resources, existing and future resources. So how do you integrate and align funding, and how do you think about other resources for maximum impact? So we're not only looking at financial resources, we're really also talking about human resources, your critical assets of your community, your residents, your partner organizations, your community institutions, your natural resources. And we really want to stress here the importance of communities making equitable decisions about how to invest resources, and the importance of cultivating a strong belief that everyone can be a force for community improvement. And Katie, you have the 6th criterion now.
Thanks, Carrie. The 6th and the last, but certainly not the least. The 6th criterion is measuring and sharing progress and results. And this criterion is about knowing where you are headed and making a community-wide commitment to measuring the quality and impact of coordinated efforts. So to further elaborate on this next slide, this involves several elements, including establishing shared goals and definitions of success across sectors and partners, around identifying measurable indicators of progress, including tracking disparities in health, and continuously using data to improve processes, track outcomes, and change course when necessary. We want to see how communities are developing systems for collecting and sharing information in ways that go beyond measuring the outcomes of a single program and moving toward being able to determine impacts across your coordinated efforts. We also encourage communities to share how you are communicating and celebrating successes when goals are achieved. And now I'm going to turn it to Erin to go into more specifics about how to apply.
Thanks, Katie. So if the 6 criteria resonate with you and you are thinking, my community really demonstrates work in these areas, your next question is probably, how do we apply? Everything that you need to apply for the prize is available at rwjf.org/prize. From the homepage, you will click on the blue hyperlink text to get more information about the 2021 prize selection process and to begin the application. This will take you to our funding opportunity page where you can find the prize criteria, eligibility information, and links to key materials. Click on the full funding opportunity link to view the call for applications brochure, which is also available in Spanish. You can download these in PDF format and print them from your own computer. We also encourage applicants to review the comprehensive frequently asked questions document that is also available for download here. These are questions that have been posed by other applicants in past years and are very helpful in understanding our eligibility, application, and selection processes. When you are ready to start putting your application together, you can click on the Apply Online button, which will take you to the My RWJF portal. This is where you will work on your application. So if you have ever applied to the Robert Wood Johnson Foundation before, you can re-enter your email address and password. There is also a place where you can click to have your password sent to you if you have forgotten it. And then if this is your first time working on an application for the foundation, you will just click on the register button and it will take you through the process. In my.rwjf.org, your application homepage will look like this. From here, you can access the different sections of the application and additional information. One thing I do want to highlight here is the resources section. From this link on the left side of the screen, you can access a range of resources, one that we want to be sure that you download, is the Instructions for Community Applicants document, which will provide detailed instructions for what I am about to overview. In the resources section is where you can also access the recording of the webinar and the slides, which will be posted within the next few days, as well as view key dates and deadlines and find other information. Another thing to note on your application homepage is the Invite Contributors button. This is how you can invite others to work on the application with you. Make sure you indicate here what kind of access you want to give the person you are inviting. It is also highly encouraged that you add at least one backup person who has access to your application materials and who can work on and submit the application for you should anything unexpected come up at the last minute. Now on your application homepage, you'll see the different sections of the application to be completed. First, you'll be asked for the name of your community, some community demographics, and 2 key contacts for the application, preferably from different organizations. And these can be 501c3 organizations as well. These will be the 2 people we will communicate with regularly regarding the status of your application. But please note that both contacts, as well as any invited contributors, will receive email communications about your application. Next, I will go through the Phase 1 essay. In the essay template, you will have the instructions, then the community demographic questions, followed by the space to start your essay. The community demographic information page is not included in the 5-page essay limit. In this section, you will be asked three questions where you will provide your community's population size, racial and ethnic breakdown, and rate of children living in poverty. Your responses must not exceed the size of the text box, as reviewers will not be able to see the additional information. You may refer to the census information links provided and/or report from other community data. And if data is limited, feel free to include your best estimates. Now, the meat of your Phase 1 application is the 5-page essay. So I will take a moment now to go over the instructions and guidelines. For the essay, in approximately the first page, we will ask you to introduce your community. We want you to tell us a little bit about the key physical, social, demographic, and economic characteristics of your community, to include the vital assets and key challenges. Include any important historical and cultural context, as well as who in your community is most affected by poor health and what root causes might be driving poor health conditions. Then describe how your community's health improvement journey began and what catalyzed collective action. We want to understand your community's story, what is unique and compelling about this place, and how you got started on this journey to better health. We really want you to introduce yourselves and make your community come alive to us. Then we ask you to showcase 4 community accomplishments. We suggest that this section be about 3 pages or 3/4 of a page per accomplishment. Accomplishments are specific policies, programs, or strategies that you have deployed in your community that best respond to identified needs and that show how you are making progress towards better health, opportunity, and equity. In describing your 4 accomplishments, we ask that you weave in information about how your accomplishments address the key challenges that your community faces, and describe if there are certain ways that your accomplishments may impact or intend to impact historically excluded populations or geographic areas. We really want to get a sense of what crucial needs and health gaps exist in your community and how you are prioritizing actions that improve the overall community and address disparities. Now, some important things to note about your 4 accomplishments. Accomplishments can be well-established or relatively new policies, programs, or strategies. We encourage applicants to demonstrate a balanced approach to community improvement that may feature well-established accomplishments as well as newly implemented efforts. Applicants often ask whether an accomplishment needs to be one specific strategy or whether it can be a group of strategies, and it can be either. Some accomplishments may focus on a particular policy or program, while others may describe a suite of activities the community is doing to address a pressing need. like early childhood education or community safety as one accomplishment. For the purposes of this application, however, accomplishments may not be planning or convening processes or the development of a coalition or initiative. So for example, conducting a community health assessment and developing a community health improvement plan would not count as accomplishments on their own. We do recognize the importance of creating coalitions and bringing people together and doing this kind of planning, but they should be considered as the predecessors for your accomplishments. They are the foundation on which your accomplishments are built. So we like to hear about these processes in your introduction, but as an accomplishment, we want to know what resulted from the coalition coming together or a community health improvement plan being developed. In approximately what will be the final page of your Phase 1 essay, we would also like you to briefly address these two questions. Describe how these 4 accomplishments represent your community's commitment to sustainable systems changes and policy-oriented long-term solutions, as described in Criterion 2. And describe how these 4 accomplishments demonstrate creating conditions that give everyone a fair and just opportunity to reach their best possible health, as described in Criterion 3. This is your opportunity to connect the dots between the accomplishments you have featured and how they demonstrate elements of the prize criteria. Now, to begin your essay, you will need to download the template from the Phase 1 essay section of the online application. The beginning of the template includes the essay instructions that I just shared. The first page has the community demographic information questions. Then you will begin your essay on the second page of the template where instructed in the highlighted area. Now, don't worry that the text you enter will appear to be highlighted. That just means you are doing it correctly. And the highlighted will not show up in your submitted version. And when your essay is complete, you will need to convert it to a PDF format, and then you will use the blue upload button to upload your final essay. Now, after you have completed your essay, we have a short worksheet, which is kind of like an abstract of the information you have already given us about your accomplishments. We ask you to provide each accomplishment name, a brief description, which of the factors from the County Health Rankings model does the accomplishment address, and approximately which year that accomplishment began in your community. It's just a brief summary of what you have already included in your essay. And then as you complete each section of the application, you can save it by hitting Save Finished at the bottom of each page. On your home page, you will then see a green check mark next to each section that has been saved as finished. Once all of the sections have green check marks, the Submit button at the top right will become active. When your application is fully complete and you are ready to submit it, you can do so using that button. And throughout this process, if you have any questions about using the online system or need any assistance with the process, please do not hesitate to contact the prize team in advance of the deadline, and we are happy to help. Next, Angela will share insights about the application process and the prize.
We have learned that there is a benefit for communities in completing the application. When surveyed, past prize applicants found that in addition to the overall benefit of winning the prize, the Phase 1 process is very valuable for their community and the work they are doing. We have also learned that the majority of applicants spend between 4 to 14 days in total actively preparing their community's application. This gives you an idea of how much time to anticipate spending on the application. The application process gave most applicants the opportunity to reflect on communities' shared accomplishments. It affirmed the ways they are working together to improve their community. It also strengthened their commitment to ensuring everyone in the community has a fair and just opportunity for health. Additionally, past prize winners shared some Phase 1 application insights. Please note, these are from different communities with their own unique experiences and are not required as there is no formula for winning the prize. For your community's Phase 1 application, Past prize winners recommended including a variety of sectors, aligning the community type with accomplishments, and compelling the community's accomplishments as a starting point. Please remember that communities use many different approaches when it comes to completing their Phase 1 application. We encourage you to do what works best for your community and the way you typically work together. We also would like to share some tips from our experience over the years as the prize team. These are several things we've seen across the years that contribute to a strong prize application, as well as common reasons that applications do not move forward. Strong applications tend to demonstrate a community-wide focus. They show a responsiveness to community needs and disparities in a way that builds on community strengths. They have a strong focus on addressing social and economic factors, which include education, employment, income, family and social support, and community safety. They provide evidence of policy systems and environmental changes. They demonstrate specific actions to remove obstacles and increase opportunities for all to be healthy. And lastly, residents, especially from historically excluded populations or geographic areas, are engaged in making decisions and implementing solutions. Applications often do not move forward because they overemphasize single organizations, programs, or neighborhoods, or they present accomplishments that are limited in scope and overemphasize coalition building, planning, or convening processes. They may include a limited breadth of accomplishments that do not reflect work across health factors, such as an overemphasis on health behaviors or clinical care, that emphasize programs and service delivery without policy and systems change. They lack information about who in the community is experiencing poor health and how disparities are being addressed. And lastly, they may lack specific examples of how residents experiencing inequitable health outcomes are engaged in driving solutions. Another thing we have increasingly focused on over the years is how communities are advancing equity and what that looks like. There are diverse approaches to advancing equity, and this is not an exhaustive or exclusive list. This is intended to give you some ideas and not to be prescriptive as to what you should include in your essay. We do not expect that communities are doing everything here, but strong applicants tend to have examples in at least one of these areas, which include creating equitable conditions, engaging residents most directly impacted by inequities, building and supporting resident leadership, changing policies, systems, institutions, and structures, fostering inclusion and cultural resilience, tracking and measuring progress toward equity. You'll see that these approaches relate to the elements across the 6 prize criteria. We have this detailed in a handout, which we will chat out now. The handout includes additional examples from prize winners that represent each of these categories. This may also be useful for you as you use it for your community work. In addition to the information we provided, you can learn more about each prize-winning community through stories and videos on the prize website at rwjf.org/prize. Also on this website, you can find the handout from the previous slide and the University of Wisconsin Population Health Institute's Action Towards Equity report. The report includes specific examples of strategies that communities are ensuring to ensure everyone has a fair and just opportunity for health. We can also find this report and other program summaries that feature past prize-winning communities on countyhealthrankings.org/prize. One other way you can learn more about the prize-winning communities and the value of the prize is through the upcoming webinar featuring past prize winners. The RWJF Culture of Health Prize Alumni Webinar, The Value of the Prize, will take place on September 15th. This is a special webinar featuring representatives from prize-winning communities. They will discuss the value of both applying for and winning the prize. You can register at the link shown below. Now, I'll turn it over to Erin to remind you of the resources available.
Thanks, Angela. So this brings us to the conclusion of the formal presentation. As a reminder, a recording of the webinar and the slides will be shared with all attendees and posted in myrwjf.org for future viewing. We do encourage you to share this webinar with your partners. And also don't forget the very important Phase 1 application deadline of Thursday, October 15th at 3 p.m. Eastern Time. We're going to keep the screen up as we go to questions and answers so that you can see the link to our website where you can find information and apply for the prize, as well as direct links to download both the call for applications and the frequently asked questions. You can also always contact our prize staff at the University of Wisconsin, who stand ready and willing to answer any further questions and be of assistance to you as you move through the application process. You should feel free to reach out anytime with questions at the email address or the phone number shown here. We are also sharing the link to the brief webinar survey in the chat. You will also receive this link in an email after the webinar. We do value your input as it helps us to improve the process each year. I will now turn it over to Olivia to share some of the great questions that have been submitted. And as a reminder, throughout the rest of this presentation, you can still submit questions via the Q&A button. Thanks. Now to Olivia.
Thanks, everyone. Thanks for all the great questions that are coming in, trying to keep up with all of them. And I think I'd really like to start with these questions about, to clarify eligibility, how we talk about whole communities, as well as who can apply, submit an application, and receive prize funds. So I'd like to start there, if that's all right, and hopefully answer these questions. Also to say that if you have specific eligibility questions at any point, it's always really helpful to contact the prize team at the information you see on the screen to talk through those, as every community has some different circumstances for sure. So first of all, what do we mean by whole communities? I think we covered that there is a definition of community that we use for the prize, and I want to reiterate that we think that of the prize as not just, it's not a grant, it's not just funds, but it is about a designation and an honor for a whole community. And we define a whole community as a jurisdiction with an elected body, such as a municipality, a city, town, borough, county, or it can be a region that it consists of geographically connected cities or counties or reservations, and we also can consider federally recognized tribes and state designated reservations in our definitions of community, as well as some special definitions for tribal communities in Hawaii. So anyway, a region can be connected jurisdictions that regularly work together on their health improvement efforts. It's not a legal definition of region, as came up in one of the questions. So so we have that geographic jurisdiction. So we're talking about places that have, policy-making bodies that can support the work, and we are interested in how the whole community is working together across many accomplishments, across several initiatives to create that community change and create a culture of health. And so we're looking for in the application several, we ask for 4 accomplishments in this first application, broadly defined, and we ask for more for those who go on. So the point being that an application to be eligible should include that work across the broad community. So we know that someone needs to bring together that application and coordinate around that and write it, and so that person could be, or a set of people can be from any organization. We ask for 2 contact people on the application. Those can be from any organization, whether or not you're a 501c3 or part of the city government or county government, or it can be any organization. Anyone can serve as that convener of the application, and the application contacts who actually submit the application. In terms of who gets the prize award money, that is determined by your own community should you advance in the process. So communities that advance to the next phase of the application, actually in the application would identify an entity that would receive that funding on behalf of the community. And that can be a tax exempt or a government entity. And there's a legal definition in our FAQs on that. So I hope that clears up some of those questions, and we can always again follow up by phone or email to answer your specific questions about your own community. And I'd check with Carrie and other presenters if there's anything you would add on that.
This is Carrie. Now, I think that's a great comprehensive response. Someone that asked specifically, can healthcare systems working collaboratively with communities apply? So yes, as a lead applicant or one of the two lead applicants. And again, just to underscore what Olivia was saying, just to really speak to the work across the community, not only what any one entity is doing or any one coalition is doing, but really thinking about your whole community and what you're seeing, the evidence you're seeing for their building a culture of health. So
yeah, I would say, yeah, thank you. We got a couple of other questions about, could a state organization apply? And a whole state is not eligible, but if you are a state network or a set of organizations that work with different communities and want to be part of a community application and talk about that work as part of a larger application, that certainly makes sense. The same goes for some of the work we had a question about a group of farm workers in the community. Like a specific group working on a specific issue isn't a definition of whole community for this prize, but that kind of work could definitely be featured as part of a city or a county application that encompasses that jurisdiction as one of the accomplishments.
Olivia, I'd also just add one of the questions of, are rural communities eligible? And I just wanted to highlight that rural communities are included. They aren't necessarily the definition of a community, as Olivia so comprehensively outlined. But as you can see in the examples of prize winners, such as the Columbia Gorge region in Washington and Oregon State, or Garrett County, Maryland, that there are rural communities that are represented in prize winners. So it is meant to encompass a wide range of population sizes or community types, and certainly not excluding based off of a single size of a community or a certain degree of rurality, for example.
Absolutely. Shall I move on to the next question, and certainly keep, as Erin said, keep typing in questions if you have others. We have a question, do you have any measurement tools you recommend to capture outcomes? Because a lot of the things that we work on are long-term collaborative challenges that won't necessarily have immediate results. I think that's a really good point. I think that we are interested in the ways that you are collecting that data and information to use both to inform your processes as well as to measure your own outcomes. So we're interested in what you're already using in your communities and hearing about that. And we're also very interested in those processes and how they reflect our 6 criteria in terms of creating long-term collaborative changes. And we aren't looking for a specific measurement tool of any kind. Would you add anything to that one?
This is Carrie. I would just underscore, the detail of criterion number 6 around telling us about how you've established shared goals, how you've got, how you're knowing you're making progress toward your destination, what are some of those indicators of progress, how you do bring the community along in your progress, and really how you're thinking about reducing disparities and examples of progress in your processes, as well as any specific examples of outcomes would be terrific too. So Katie, would you like to add anything?
I think you all both covered it. And I think just to, again, to this conversation around what does it mean to be an accomplishment or a whole community, I would just add that in that spirit, I think we recognize it takes multiple people, multiple activities to create that longer term change. And so helping us, as Carrie and Olivia both described, helping reviewers understand how do the pieces fit together for that longer term change, and how did you make decisions about what to include that you knew that that change was going to happen, will be helpful for us to understand where you're headed as a community, where you've been and where you're headed, and what you're looking to accomplish. Both what you have accomplished and what you're looking to as the future continues.
Thank you. Getting a couple of questions about, so one is, how involved does each organization in the community project need to be in submitting an application? There's also a question coming in about, is there a minimum or maximum number of partners that need to be involved? So we don't have any kind of set number of partners that should be involved. We're looking for you to describe how your work reflects the community. And so we are looking for how you take a collaborative approach, and whatever, so whatever the partners that are involved, we would want to hear about that. As far as submitting the application, again, we know that there's going to be probably a smaller number of people who are actually involved in writing an application and submitting it and convening it. But we have found, I think that prize winners tend to be very collaborative, and so as you move further in the process, we, especially if we go to, you make it to a site visit in our finalist community, we will look to be hearing from a wide range of your partners. And so I would just take that into account as you are engaging people in the process. Anything else on that?
It seems like the related question around, do other organizations outside the two contexts, the applicants, need to know the application is being submitted?
Thank you.
I think in the spirit of partnership and inclusivity, that absolutely, if you're featuring the work of those partners, then you'd want to involve them in the process. But I don't know, Katie, Olivia, we don't provide guidance on that. Katie, Olivia, what would you add?
I would just underscore what you've all both said, which is this is a reflection of your community, and we want to understand your community. And so we leave it to you in terms of how you notify, who you notify, and recognize that ultimately this is a collaborative process, and both for what the prize represents and what will happen in the future as the prize process continues to unfold. So just want to keep that principle of partnership and collaboration in mind as you all move forward.
And a technical thing I guess I would also highlight is that the two people who are listed as contacts in your application will both get communications about your application and its status, as well as sometimes I believe anyone who you've added as an invited contributor would get those communications as well. Are there examples of how the prize has actually been spent in a diverse community? Noting we have so many organizations and entities involved, I'm having trouble envisioning who might actually share in the financial prize, how it will be divided equitably between different organizations. Listing here city, chamber of commerce, nonprofits, hospitals, and schools, all involved in the culture of health efforts. Should I take a first shot at this one? So as mentioned, the prize funds are an award, and we don't gather reports on the expenditures of how communities have used that money. It's sort of up to your community, and again, your processes for how you might do that. I will say that there have been some really, I think, exciting examples that we've heard anecdotally about communities who maybe have set up, a community mini grant fund, or who have had their community members vote, or had community conversations about how they should spend the money, who have leveraged the money for matching funds to grow a larger fund, or who have used it for a specific community project that they were looking to complete and identified as part of this process. So those are a few anecdotes, I guess we know. If there are others or other advice, my colleagues would chime in. Welcome that.
Go ahead,
I was
Katie.
also thinking of those anecdotes, Olivia. What I was going to add is, again, just a couple technical aspects, which is those two individuals that are the designated contacts on the application do not necessarily have to be the designated entity that receives the funding. You'll see in the frequently asked questions that we do talk about what happens with that designated community organization, where it does go through some due diligence on our part as a foundation to make sure that we can provide the prize money to that entity, given that we are a private foundation, and given the principles of the program. So that there will be some conversation with you about that designated entity later on in the prize process after the phase 1 process. So just wanted to keep that in mind as folks are both anticipating their contacts as well as what we mean by a designated entity, and then ultimately determining for themselves how best to use that prize that's recognizing the work that they as a community are doing.
Sorry. Should I move on, Carrie? Or you have
Yeah, I think we've got time, and there's a really important question.
There's an important question here, and another one that related that came in through the registrations, which is, do we anticipate doing site visits during the pandemic, as well as, how might the pandemic affect accomplishments in communities? I'm trying to find this other question that I saw. So we are monitoring the situation. Of course, we did postpone the 2020 site visits given the pandemic, and we will have to see how things unfold. But we will certainly keep applicants informed of any decisions that we need to make on that. And in terms of how the pandemic affects an application, I may think that we are thinking about ways that communities are addressing many issues in their community, and I think that COVID-19 is one of many of those kinds of crises or challenges that a community is facing, and so we're interested, if there are ways that your community has responded that make sense and reflect our 6 criteria. I think that's one of the things that could be part of an application. It's certainly not required, but we're interested in how your community is dealing with COVID-19 and things like it, addressing disparities and considering equity in many ways. Are there, what would you add to future plans? And
I think that's right. I'm also looking at the clock a little bit, but just to underscore, I know Angela's going to close us out, but just to underscore, yeah, we know that our communities have a lot at their doorsteps right now, and we certainly are very mindful of everything that you all are confronted with, and we appreciate your work so much, and really thank you for your interest. So you are our seeds of hope, and I'll give Angela the last word. And just to underscore, just contact us at any time at the University of Wisconsin. We're always available to answer your questions. So Angela, would you close us out, please?
I sure will. And we just really want to thank everyone for taking the time out today to join us. This is very exciting to really think about the different communities that we'll see that are going after the Culture of Health Prize. We will also be following up by email with the webinar recording and also a link to the evaluation. And we'll really appreciate your feedback about today's session. We thank you for joining us today, and we wish you well during the application process.